My name is Wouter Schievink. I'm a neurosurgeon at Cedars-Sinai Medical Center. I remember quite well when I became interested in cerebrospinal fluid leaks. It was about 1991, and I was working at the Mayo Clinic in Jacksonville, Florida. We had a patient in her 20s who had been complaining of unbearable headaches. A leak was identified. We took her to the operating room the next day. We were able to fix her leak, and she was cured. The most common symptom, I would say, more than 95% of patients that we see do present with a headache. Now, of course, headaches are very, very common, but this is usually described as a uniquely different type of headache. It's described as a very positional headache.
My name's Connie Deline. I am a patient with a spinal CSF leak. I'm also a physician. My first symptoms were severe headache, nausea, vomiting, pain between my shoulder blades. What I noticed pretty quickly about the headache was that if I would lay down, it improved quite considerably. It didn't go away, but it improved a lot. And if I raised my head up again, then it got much, much worse.
The reason why these headaches are usually so much worse when the person is upright is that the brain floats on spinal fluid, and if you're leaking spinal fluid in the spine, the brain sort of gets sucked down towards the spinal canal, and that causes a lot of traction on structures of the brain that are very sensitive to pain.
The headache was escalated over the course of 20 or 30 minutes and was located at the back of my head, at the base of the skull. So it was clearly a very positional headache. I hadn't ever experienced headaches before. So this was new, and it was pretty obvious to me that this was something significant.
Unfortunately, we know really very little about how common these leaks in the spine are. We really only diagnose patients who have significant symptoms from that. And I think there probably are many, many patients who go undiagnosed.